defects. All cause a normocytic normochromic anemia caused by trauma to the RBC. All are acquired disorders that cause intravascular hemolysis with schistocytes and thrombocytopenia.
Microangiopathic hemolytic anemias, S. Disseminated intravascular coagulation, DEC. Systemic clotting is initiated by activation of the coagulation cascade due to toxins or conditions that trigger release of procoagulants, tissue factor. Multiple organ failure can occur due to clotting. Fibrin is deposited in small vessels, causing RBC fragmentation. Hemolytic uremic syndrome, US, occurs most often in children following a gastrointestinal infection, e.g. E. coli. Clots form, causing renal damage. Thrombotic thrombocytopenic purpura, TTP. TTP occurs most often in adults. It is likely due to a deficiency of the enzyme ADAMS13 that is responsible for breaking down large von Willebrand factor multimers. When multimers are not broken down, clots form, causing RBC fragmentation and central nervous system impairment. March hemoglobinuria, transient hemolytic anemia that occurs after forceful contact of the body with hard surfaces, e.g. marathon runners, tennis players. Other causes. Infectious agents, e.g. P. falciparum, Clostridium perfringens, damage the RBC membrane. Schistocytes and spherocytes are seen on the blood smear. Mechanical trauma, caused by prosthetic heart valves, Waring-Blender syndrome, chemicals, drugs, and snake venom, damage the RBCs through various mechanisms. Thermal burns, third degree, cause direct damage to the RBC membrane, producing acute hemolysis, which is characterized by severe anemia with many schistocytes and microspherocytes. Hemoglobinopathies. Introduction. These are a group of inherited disorders causing structurally abnormal globin chain synthesis due to amino acid substitutions, qualitative defect. Changes in RBC deformability and electrophoretic mobility can occur. Homozygous disease conditions, both globin chains affected, are more serious than heterozygous trait conditions, only one globin chain affected. Target cells are associated with the hemoglobinopathies. Hemoglobin electrophoresis, isoelectric focusing and/or DNA (PCR) analysis may be used to confirm the diagnosis. The amino acid substitution causing formation of HGBS is the most common, HGBC is the second most common, and HGBE is the third most common. Sickle cell disease, HGBSS. Sickle cell disease is caused when valine replaces glutamic acid at position 6 on both beta chains. It results in a decrease in hemoglobin solubility and function. Defect is inherited from both parents. Occurs most commonly in African American, African, Mediterranean, and Middle East populations. No HGBA is produced, and approximately 80% HGBS and 20% HGBF, the compensatory hemoglobin, are seen. HGBAG is variable. Hemoglobin insolubility results when deoxyhemoglobin is formed. Hemoglobin crystallizes in erythrocytes. It is characterized by the classic sickled shape of erythrocytes. Clinical findings. Erythrocytes become rigid and trapped in capillaries. Blood flow restriction causes lack of oxygen to the tissues, resulting in tissue necrosis. All organs are affected, with kidney failure being a common outcome. Hyposplenism and joint swelling also occur. Vaso-occlusive crisis occurs with increased bone marrow response to the hemolytic anemia. Crisis can be initiated by many physiological factors, including surgery, trauma, pregnancy, high altitudes, etc. Apparent immunity to Plasmodium falciparum. Diagnosis is made after 6 months of age, time of beta-gamma globin chain switch, with life expectancy of 50 years with proper treatment. Death usually results from infection or congestive heart failure. Laboratory. Severe normochromic normocytic hemolytic anemia with polychromasia resulting from premature release of reticulocytes. Bone marrow erythroid hyperplasia, ME ratio decreases. Sickle cells, target cells, nucleated RBCs, Pappenheimer bodies, and Howell-Jolly bodies are seen. Increased bilirubin and decreased haptoglobin are characteristic due to hemolysis. Positive hemoglobin solubility screening test. HGBS migrates with hemoglobins D and G on alkaline hemoglobin electrophoresis, can differentiate using acid electrophoresis. Sickle cell trait, HGBAS. Sickle cell trait is caused when valine replaces glutamic acid at position 6 on one beta chain. Defect is inherited from one parent. One normal beta chain can produce some HGBA. Approximately 60% HGBA and 40% HGBS are produced, with normal amounts of HGBs A, Z, and F. This heterozygous trait is the most common hemoglobinopathy in the United States. Positive hemoglobin solubility screening test. Sickle cell trait generally produces no clinical symptoms. Anemia is rare, but if present, will be normochromic normocytic, and sickling can occur during rare crisis states, same as in HGBSS. Apparent immunity to Plasmodium falciparum, HGB-CD's HGB, occurs in the African American and African populations. HGB-C disease is caused when lysine replaces glutamic acid at position 6 on both beta chains. Defect is inherited from both parents. No HGB-A is produced. Approximately 90% HGB-C, 2% HGB-AZ, and 7% HGB-F are produced. Mild anemia may be present. Laboratory: normochromic normocytic anemia with target cells, characterized by intracellular rod-like C crystals. HGB-SC disease. HGB-C migrates with hemoglobins A2, E, and O on alkaline hemoglobin electrophoresis, can differentiate hemoglobins using acid electrophoresis. The heterozygous HGB-C trait patient is asymptomatic, with no anemia. The one normal beta chain is able to produce approximately 60% HGB-A and 40% HGB-C, with normal amounts of HGB-A and HGB-F. HGB-SC disease is a double heterozygous condition where an abnormal sickle gene from one parent and an abnormal C gene from the other parent is inherited. Seen in African, Mediterranean, and Middle Eastern populations, symptoms less severe than sickle cell anemia, but more severe than HGB-C disease. No HGB-A is produced, approximately 50% HGB-S and 50% HGB-C are produced. Compensatory HGB-F may be elevated up to 7%. Laboratory: moderate to severe normocytic normochromic anemia with target cells, characterized by SC crystals, may see rare sickle cells or C crystals. Positive hemoglobin solubility screening